Hyperemesis has hit the headlines this week, and it's a condition which starts early in pregnancy, usually before 16 weeks, and it's just horrendous. It's a severe inability to eat, nausea and vomiting. It can cause weight loss and dehydration. It can cause mental health impacts for women and people. And also, in the worst case scenario, it can lead to death when women are not listened to and treated appropriately. Common is hyperemesis, so it does vary by country and across the world, and there is a concern that hyperemesis is largely underdiagnosed here in the UK. The current statistics are that around about 30,000 pregnancies every single year here in the UK are diagnosed with hyperemesis, but there might be a large cohort of women and people where it's not diagnosed or treated appropriately or not written down as such. For some people, it lasts the entire pregnancy and it doesn't go away until the baby is born. And it is so debilitating. It impacts on every single part of that woman or person's life. What causes hyperemesis? Well, researchers are still trying to find out. At the moment, there is a genetic marker that they believe is linked to why some women and people are more likely to develop hyperemesis, particularly why there tends to be a genetic link whereby if your mum or your sister had severe nausea and vomiting in pregnancy or hyperemesis before, you're more likely to experience it. And similarly, why if someone's had it before, they're more likely to have those symptoms again appear in a future pregnancy too. This and finding the cause of it will help with treatments in the future. It's really important that if you do have any symptoms of hyperemesis, you have a conversation with your midwife and your GP for appropriate treatment. In the most severe cases, it can lead to dehydration. And symptoms of dehydration include headaches, low blood pressure, dizziness, really bad fatigue, unable to keep any fluids or food down at all, having dry lips or a dry mouth, being very thirsty, having reduced urine output as well, and particularly really dark, concentrated urine too. Pregnancy sickness support have got some fantastic help sheets to be able to help. Eating little and often, ice chips, having ice cubes that you can just suck on in your mouth can be really beneficial. Thinking about acupins can also be useful. The most important treatment though is antiemetics, so anti-sickness medication and rehydration therapy. For people with hyperemesis, these are the two best treatments that anybody can take. They will start off on certain types of anti-sickness and they will build it up, and often women and people will need some degree of a cocktail of lots of different medications to help control their symptoms. Hyperemesis is the reason behind 37,000 admissions every single year, but there are some fantastic initiatives going on where women can be rehydrated at home. And having the ability to have rehydration therapy at home not only helps to save the planet, because what happens is there's less admissions, there's less inpatient visits, there's less waiting around time, there's less treatment that's needed, and women tend to actually recover better at home as well. Also means that they can balance childcare or work a little bit easier, or that rest time that they really need as opposed to being in a really busy hospital environment. So there are some really great initiatives going on, looking at the care pathways and making it much better for women and people across the country. There are some ongoing clinical trials such as the Emerald study as well, and you can check out BUMPS. It's a website dedicated to the medications that are prescribed in pregnancy, the safety, the side effects and everything else. Really useful if you are prescribed any medication. Work with your GPs, get that psychological support from your midwife, call pregnancy sickness support. You are not alone, and I'm so sorry if you are experiencing this, and I long for the day where hyperemesis is properly listened to, treated, diagnosed appropriately, and where women and people have the appropriate support that they need. Getting you the right treatment is the most important thing. And I'm thrilled that it's been discussed at a round table to improve women's health in this area, because it is so needed at this stage.